Hello, my name is Homaira, and I am a clinical pharmacist working at the University of Ottawa Heart Institute. Today, I will be presenting you with helpful information about commonly prescribed heart medications that you may be taking. Please note the disclaimer. The information presented at this session is not a substitute for, nor does it replace professional medical advice that you receive from your physician or healthcare provider. If you are in Canada and think you are having a medical or health emergency, call your healthcare professional or 911 immediately. Let's begin. There are many types and combinations of medications used to treat heart conditions, and your doctor will decide the best treatment combination for you. This video provides valuable information regarding the following commonly prescribed cardiac medications: amiodarone, angiotensin-converting enzyme inhibitors and angiotensin receptor blockers, antiplatelets, beta blockers, calcium channel blockers, digoxin, diuretics, neprilysin inhibitor, angiotensin receptor blocker combination, SGLT2 inhibitors, statins, and lastly, nitroglycerin spray. For each type of medication, I will highlight how they work, what is the purpose of the medication, how should the medication be taken, potential side effects, when to seek medical attention, how to monitor if treatment is effective, where to store the medication, and what to do in the event of a missed dose. To start, amiodarone is also known by its brand name, Cordarone. It is often prescribed to treat or prevent abnormal heartbeats, which are called arrhythmias. This medicine slows the electrical signals in your heart muscle, which helps your heartbeat go back to normal and helps your heart work better. When first starting amiodarone, your doctor may ask you to take a loading dose, which can be a larger or more frequent dosing that may be taken for up to 2 weeks. Eventually, you will only be taking the medication once a day. Avoid grapefruit juice, as this can increase the amount of amiodarone in your body and increase the chances of side effects. It is important to be aware of potential side effects while on amiodarone. Skin sensitivity to sunlight, and you could get a sunburn easily. If you have been taking amiodarone for a long time, sunlight may turn your skin a blue-gray color. What you can do about it is stay out of direct sunlight, such as the midday sun. Use SPF of at least 30 that contains titanium or zinc oxide. Wear a hat, sunglasses, and clothing that will protect you from the sun. Do not use tanning beds. If you are experiencing side effects that are bothersome to you or severe, let your doctor know. Upset stomach is quite common with larger doses, and it helps if you take with food. Contact your doctor if it's not improving or severe. Taste disturbances and difficulty sleeping may also occur, and let your doctor know if this is bothersome for you. Feeling very tired, let your doctor know if it's affecting your daily activities. If you experience persistent cough, breathlessness, these could be symptoms that the amiodarone may be affecting your lungs. Yellowing of the skin or the whites of the eyes may be symptoms of amiodarone affecting your liver. So if you experience any of these symptoms, you should contact your doctor for advice right away. Your doctor will monitor you by checking your heart rate, doing routine blood tests for thyroid level, for liver function, getting eye exams regularly, and checking your lungs. Treatment with amiodarone is usually long-term. You should continue to take this medication unless you are advised otherwise by your doctor. Something to note is that amiodarone stays in your body for a long time. So even if you have stopped taking your amiodarone, you may continue to experience a side effect from it for up to 2 weeks or even a month as the medication slowly leaves the body. Next up are 2 very common classes of heart medications called angiotensin-converting enzyme inhibitors and angiotensin receptor blockers. Angiotensin converting enzyme inhibitors are commonly called ACE inhibitors, and angiotensin receptor blockers are also known as ARBs. The most commonly prescribed ACE inhibitors and ARBs are listed here. The list has generic names followed by their brand names in brackets to help you identify what you may be taking. You will notice that the generic name of ACE inhibitors ends in pril. Examples include perindopril, ramipril. People also know their medications by their brand names, such as ramipril's brand name is Altase. ARBs are listed on the right side of the slide. The generic name of ARB ends in sartan, such as telmisartan or valsartan. Again, they may be known as their brand name, such as telmisartan's brand name is Micardis. ACE inhibitors and ARBs work similarly in the body. Specifically, they open up the blood vessels and make it easier for the blood to flow through. This lowers your blood pressure. Also, they make it easier for your heart to pump by blocking stress hormones and relieving the stress on the heart's pumping action. If your heart has been weakened, an ACE inhibitor or ARB improves heart function. It will protect the heart and blood vessels and help it get stronger. Furthermore, it reduces the risk of having future stroke, future heart attacks, and protects the kidneys. This medication is taken by mouth once or twice a day. Take exactly as you have been prescribed by your doctor and take it at the same time every day. If you take it more than once a day, space it out throughout the day, such as with breakfast and dinner. ACE inhibitors and ARBs can cause some side effects. The most common side effect of an ACE inhibitor is that you may develop a dry cough or tickle in the throat that does not go away. This does not require stopping the medication unless it is bothersome to you. For some people, it is very bothersome, so they switch to an ARB because less cough is seen with ARB. ACE inhibitors and ARBs will lower your blood pressure, which may make you feel dizzy. If you are dizzy or feel like you might faint, you should sit or lie down right away so you don't fall. When you get up, do it slowly and move slowly. If you are experiencing dizziness and you take your ACE inhibitor once a day, try taking it at bedtime. If you take it twice a day, separate the times evenly throughout the day, such as with breakfast and bedtime, so the blood pressure lowering effect of the medication is spread out over the day. Do not drive a motor vehicle or operate machinery if you are dizzy. Take your blood pressure and see if you are in the target range advised by your doctor. With a new start of an ACE inhibitor or ARB, you may experience headache that may go away as your body adjusts to a new medication. You can talk to your doctor about a headache that is not going away. If needed, acetaminophen or Tylenol is the safest medication to take for headaches and pains. ACE inhibitors and ARBs can also increase the amount of potassium in your body, and your doctor will monitor this through routine blood tests. Avoid salt substitutes, which contain potassium, or potassium supplements unless they are prescribed for you by your doctor. If you notice that you are peeing less than usual, let your doctor know right away. A serious side effect you may experience is angioedema. This is swelling of the lips, face, eyes, mouth, or throat. If this happens to you, go to the closest emergency room. You will be given treatment and your medications will be reviewed to make sure you are taking what is safe for you. You can help monitor your therapy by keeping a written record of your blood pressure. It could be from your doctor's office visit, the automated blood pressure machine at the pharmacy, or your home blood pressure monitor to follow up with your doctor to make sure that you are staying in your target blood pressure range. As mentioned earlier, your doctor will request blood tests to monitor your kidneys and potassium level to make sure that this medication is safe for you. The next class of medications I will discuss are called antiplatelets. The generic names are listed here, followed by their brand names in brackets. For example, aspirin is a brand name for the generic medication acetylsalicylic acid, also known as ASA. Antiplatelets work by making your blood less sticky and keeps blood clots from forming by preventing blood platelets from sticking together. This prevents arteries and stents from being plugged by clots. Thus, it is prescribed in people who have had a cardiac event, such as heart attack, stent, heart surgery, and unstable angina. Some patients who have heart attacks that have stents placed in their coronary arteries or have had coronary artery bypass graft surgery, also known as CABG, are treated with 2 types of antiplatelet agents at the same time to prevent blood clotting. The antiplatelet and how long you will be on it is determined by your heart doctor based on your risk of blood clots and bleeding. Take your antiplatelets exactly as prescribed. It's taken by mouth once or twice a day. I want to mention an important point about the dose of ASA. Your doctor will prescribe the dose that is appropriate for your condition. The lower dose of ASA is used to protect the heart rather than using a high dose, which is greater than 325 milligrams, which is usually used to treat pain. This is because at higher doses, ASA takes on an anti-inflammatory effect similar to a class of medications called NSAIDs, which are the short form for non-steroidal anti-inflammatories, a common one being ibuprofen or Advil. We try to avoid NSAIDs for daily use in people with heart conditions because it increases blood pressure or the fluid that is kept in the body and may increase the risk of bleeding and possibly bad effects on the kidneys. Generally, when you are prescribed the low dose of ASA, it is best to take ASA 81 milligrams for daily use. The 81 milligram tablet is coded to be safe for your stomach for daily use. There is a chewable form of baby aspirin available that is 80 milligrams. This does not have the protective coating. Potential side effects are upset stomach, usually seen with ASA. You may notice nausea, diarrhea, heartburn, for which you can try taking the medication with food. Light bruising is normal, but please mention these symptoms to your healthcare team and they may be able to provide additional suggestions for management. Be careful and try to avoid injury. Use a soft toothbrush when brushing and an electric razor to minimize risk of getting a cut. Risk of bleeding and bruising is higher if you are taking 2 antiplatelet medications. An important note is acetaminophen or Tylenol is the safest medication to take for aches or pains while you are on an antiplatelet rather than using ibuprofen or naproxen, which, as mentioned earlier, may increase risk of bleeding when used with your antiplatelet therapy. If you get a cut or nosebleed, gently press on it until the bleeding stops. Shortness of breath or difficulty breathing has been reported as a side effect of ticagrelor. Please let your doctor know right away if you experience this. Your doctor will review your symptoms and decide if you may benefit from switching to another antiplatelet medication. Gastrointestinal bleeding is an important side effect to be aware of. If you notice throwing up or coughing up blood, vomit that looks like coffee ground, dark urine, blood in urine, black or tarry stools or abnormal vaginal bleeding, bruises without a cause or that get bigger, bleeding you cannot stop, check with your doctor right away. It is really important to let your healthcare team, such as your physiotherapist, chiropractor, naturopath, dentist, know that you are taking an antiplatelet. Do not stop taking your antiplatelet unless instructed by your healthcare provider. Please note that if you're having surgery or dental work, your doctor may ask you to temporarily stop taking your antiplatelets a few days before the procedure. Take notes from your doctor on when to stop and restart your antiplatelet therapy. and a reminder to be aware that if you experience any of the following: bad stomach pain, blood when you throw up, blood in urine or stool, heavy bleeding or bruising that is unusual while on antiplatelet therapy, call your healthcare provider or go to the emergency right away. Your doctor will monitor you for signs of bleeding and follow up with any side effects you may be experiencing and can request blood work to check hemoglobin if there is a suspicion of bleeding. We now move on to beta blockers. This is a list of some of the commonly prescribed beta blockers. You will notice that the generic names end in lol. As you know, your heart works hard, pumping blood through your body. But this constant hard work can put too much stress on your heart muscle and blood vessels. Beta blockers relieve the stress on the heart by slowing down your heart rate, and in this way, also lowers the blood pressure. If your heart has been weakened, beta blockers may protect it and help it get stronger. They may help relieve chest pain or pressure and relieve angina symptoms, and they are used to reduce chance of another heart attack in someone who has already had one. They're used to treat many conditions such as heart failure, heart rhythm problems, coronary artery disease, and high blood pressure. They are taken by mouth once, twice, or 3 times per day, depending on which beta blocker you are on, and it should be taken at the same time each day. If you take it more than once a day, space it out throughout the day. Beta blockers can have side effects. Some people feel tired or feel dizzy or lightheaded. This usually improves with time. Beta blockers will slow your heart rate and lower your blood pressure. So if you feel dizzy or feel like you might faint, sit or lie down right away. Get up slowly to give your blood vessels time to adjust. Do not drive a motor vehicle or operate machinery if dizzy. Take and keep a record of your blood pressure and heart rate. Decreased sexual ability and nightmare or mood changes can occur, and you can talk to your doctor about bothersome side effects that are not improving with time, as there may be ways to treat that. If you have diabetes and take a beta blocker, monitor your blood sugars closely, as it may be harder to notice the effects of low blood sugar, such as trembling or fast heart rate. Please note that beta blockers do not affect sweating or dizziness caused by low blood sugar. If you have asthma, let your doctor know that you have a diagnosis of asthma before starting a beta blocker, and contact your doctor if you notice any changes with your asthma symptoms. Your doctor will be monitoring your blood pressure, heart rate, and any side effects that you may be experiencing. Make sure to ask your doctor of your target range of blood pressure and heart rate. Keep a written record of your heart rate, which is also called pulse, and the blood pressure. It could be from your doctor's office visit, the automated blood pressure machine at the pharmacy, or your home blood pressure monitor to follow up with your doctor to make sure that you are staying in your target range. An important point about beta blockers is to not stop taking it abruptly, as this can lead to rebound increase in blood pressure and heart rate. Discuss with your doctor on how to safely change the dose if that is needed. The following slides will go over calcium channel blockers, which are also known as calcium channel antagonists. Commonly prescribed calcium channel blockers are listed with the generic name first, followed by their brand names in brackets. For example, Norvasc is the brand name of amlodipine. Calcium channel blockers widen and relax your blood vessels. This can help lower blood pressure, slow your heartbeat, control an irregular heartbeat, reduce chest pain that is caused by reduced blood supply to the heart muscle. It is taken by mouth, usually once a day, at the same time each day. Avoid grapefruit or grapefruit juice, as that can boost the effect of some calcium channel blockers. This could make your blood pressure too low, which can cause symptoms such as headaches and dizziness. Do not chew, cut, crush, or dissolve extended release tablets. Calcium channel blockers have relatively few side effects that include fatigue, dizziness, which if you experience, try to get up from lying or sitting positions slowly and move slowly. Do not drive a motor vehicle or operate machinery if dizzy, and take your blood pressure. Fast heart rate is also known as palpitation. Swelling in your ankles or feet, let your doctor know if large amount of swelling is seen. Constipation, for which you can eat diet rich in fiber, stay well hydrated, and if this still persists, can speak to your pharmacist for over-the-counter constipation relief options. If you are experiencing these side effects, which are bothersome to you and not improving with time, please let your doctor know. Your doctor will be monitoring your blood pressure, heart rate, swelling in your ankles or feet, and also do routine blood work for kidney function. The next type of medication I want to tell you about is called digoxin. It is also known by its brand names Lanoxin or Taloxin. This medication increases the force of the heart's contractions, so your heart can pump with more force. It slows the heart rate and reduces shortness of breath. You may be prescribed digoxin to relieve heart failure symptoms or to slow certain types of heart rhythm problems, such as atrial fibrillation. Take your digoxin exactly as prescribed. It is usually taken by mouth once a day at the same time each day and can be taken with or without food. Please be aware that there are many drug interactions with digoxin. Please talk to your doctor or pharmacist before taking any medications, health products, vitamins, minerals, and supplements. Your doctor may ask you to go for blood tests to see how much digoxin is in your body if there is a concern for interaction. Side effects seen include upset stomach, diarrhea, loss of appetite or vomiting. If severe, contact your doctor right away or go to the emergency. Dizziness or weakness, try to get up and move slowly. Do not drive a motor vehicle or operate machinery if dizzy. Take and record your blood pressure and contact your doctor if not improving or if severe. Call your doctor right away or go to the emergency if you have any of these side effects: irregular or uneven heartbeats, blurred vision or disturbances in color vision. You might see yellow, green, or white spots around objects. Your doctor will monitor your blood pressure, heart rate, and you can keep a record of your blood pressure and heart rate and bring it to your doctor's appointment to review with your doctor. Also, as previously mentioned, regular blood tests will be requested to check digoxin level, potassium level, and creatinine, which is a measure of kidney function. Diuretics are also known as water pills. Some commonly prescribed diuretics are listed on this slide with generic names first, followed by their brand names in brackets. These medications help your kidneys make more urine to remove extra water from your body. This lowers your blood pressure and helps reduce heart failure symptoms. They also reduce swelling from excess buildup of fluid in body, such as from legs and ankles. The more you pee, the more excess salt and water you flush out of your body. Without the extra fluid, it's easier for your heart to pump. Different diuretics remove different amounts of fluid from your body by different pathways, so your doctor will assess whether you may benefit from taking 1 or 2 diuretics to manage your condition. They are usually taken once daily, earlier in the day, so you can go to the bathroom during the day. Take it at least 6 hours before bedtime to help avoid getting up in the night. You may experience some mild side effects that may go away over time: going to pee more often, dizziness, drowsy, or feeling tired. Try to get up and move slowly. Do not drive a motor vehicle or operate machinery if dizzy. Take blood pressure. Thirst and dry mouth, you can try chewing sugar-free gum or using sugar-free sweets. You can use a moisture or a biotin moisturizing spray. It's found in the pharmacy. Maintain good oral hygiene. and suck on ice cubes. If you experience nausea, diarrhea, constipation, try taking with food. Contact your healthcare team if these side effects are bothersome, not improving, or severe. Be aware that furosemide may cause your skin to be more sensitive to sunlight, so protect yourself from sunburn if you are on this medication. If you just started on a diuretic and notice a new skin rash, fainting, muscle cramps or weakness, yellowing of skin or eyes, passing little or no urine, call your doctor right away. For monitoring, your doctor may tell you to record your weight every morning in a calendar and bring this with you to your doctor's appointment. Changes in your weight can show whether or not you're losing fluid. Weight changes help your doctor adjust the dose of your medication based on whether you are losing or gaining weight. Your doctor will also be monitoring your blood pressure, regular blood work to check potassium levels, and creatinine, as diuretics affect the amount of potassium in your body. Your doctor may prescribe a potassium supplement if your potassium level is low to take with your diuretic. An important recommendation for patients with heart condition is to limit how much salt you eat. Do not use salt substitutes without first talking to your healthcare provider or pharmacist, as salt substitutes contain potassium, which is closely monitored while you are on diuretics. Also, since diuretics affect the amount of water in the body, ask your doctor if you should restrict your fluid intake. For example, a patient with heart failure may be prescribed a diuretic to reduce water in their body, so it's not helpful to drink more water to replenish what is trying to be lost. Next, I will go over a unique combination medication, sacubitril/valsartan. This is a combination of the neprilysin inhibitor sacubitril and the angiotensin receptor blocker valsartan. The brand name for this is Entresto. Neprilysin is an enzyme that breaks down natural substances in the body that open narrowed arteries. By limiting the effect of neprilysin, it increases the effect of these substances to widen the blood vessels and lowers the blood pressure, and helps the body get rid of extra salt and water. It is important to note that Entresto is used in place of an ACE inhibitor or ARB because it contains an ARB. You cannot take Entresto if you are taking an ACE inhibitor or ARB. If you are on an ACE inhibitor, you must stop taking the ACE inhibitor 2 days before starting an Entresto. This is called a washout period. Moreover, this medication is used to treat heart failure. It is taken twice a day. At first, you will start with a low dose, which increases over a few weeks. The most common side effects reported are low blood pressure. Contact your doctor if this is affecting daily activities. Dizziness, lightheaded, tired. Try to get up and move slowly. Do not drive a motor vehicle or operate machinery if dizzy. Take blood pressure. Contact your healthcare team if there is no improvement or if it's very severe. Dry cough. Contact your healthcare team if this is bothersome. Increased potassium levels in blood, which is also known as hyperkalemia. Your doctor will monitor by regular blood tests to make sure your potassium is in the normal range. Sometimes Entresto can cause a rare but serious allergic reaction called angioedema, which is swelling of the lips, face, tongue, throat. This is rare. Get medical emergency help right away by calling 911 if you have symptoms of angioedema or trouble breathing. Do not take Entresto again if you have had angioedema while taking Entresto. Your doctor will be monitoring the following: blood pressure. Keep a record of your blood pressure and bring to your doctor's appointment. Routine blood work to check your potassium and creatinine to make sure it's in normal levels. SGLT2, which stands for sodium glucose cotransporter 2 inhibitors, are a relatively new class of medications being used to treat heart conditions. The generic names of SGLT2 inhibitors end in gliflozin, and their brand names are listed in brackets here. This medicine works in the kidneys, so that excess sugar comes out in your urine. So it is able to reduce blood sugar level, and we see better control of blood pressure. Thus, it is prescribed in patients with heart failure with or without type 2 diabetes. It is taken by mouth once a day at the same time each day. Possible side effects seen with SGLT2 inhibitors are yeast infection, which may feel like itching, burning, redness, swelling, discharge from genital area, urinary tract infections, which may feel like pain or a burning sensation when peeing, needing to pee more often, cloudy and or bloody urine. Thus, use exceptional perineal care to avoid urinary tract and yeast infection. Monitor your genital area and let your doctor know if you think you have developed an infection to get appropriate treatment. Low blood pressure, dizziness, lightheaded, feeling tired, try to get up and move slowly. Do not drive a motor vehicle or operate machinery if dizzy. Take blood pressure. Contact your doctor if it's not improving. Diabetic ketoacidosis, also known as DKA, is when acid levels get too high in the blood. Symptoms of this are nausea, vomiting, lack of appetite, abdominal pain, excessive thirst, difficulty breathing, confusion, unusual fatigue, sleepiness. DKA is rare, but serious, and it needs urgent medical treatment, so go to the nearest hospital's emergency. This is most likely to happen at the time of surgery, severe infection, or illness. To reduce the chance of DKA, your doctor will advise you to stop taking your SGLT2 inhibitor at least 3 days before major surgery. You should also stop taking this medication if you're unable to eat or drink, such as when you are sick, vomiting, have diarrhea, and possibly dehydrated, until you feel better. Let your doctor know or seek emergency medical help if you are not feeling better or getting worse. Your doctor will monitor blood pressure and any side effects you may be experiencing, and also do blood tests to check your kidney function to make sure this is safe for you to take. Statins are also known as HMG-CoA reductase inhibitors. This slide lists commonly prescribed statin medications. Note the generic name ends in statin. Their brand name is listed in brackets. I want to mention that there are many types of cholesterol-lowering medication, statins being one of them. However, statins are the most commonly prescribed as they work really well to lower LDL, which is the bad cholesterol in the blood. When LDL or bad cholesterol level is high, this can make plaque or fatty deposits on your arteries and block the blood flow to the heart. By lowering this, they lower the risk of future heart attacks. Statins help stop plaque from forming in your blood vessels and can also prevent existing plaque from getting worse. They are taken orally once a day, usually at night. Avoid grapefruit or grapefruit juice, as statin concentration may be increased and lead to symptoms of muscle pain. Some people may experience muscle pain or cramps. If it doesn't go away, lowering the dose or switching to a different statin may help. Talk to your doctor about your options. Yellowing of skin or eyes may indicate liver disease. Severe liver impairment is a very rare side effect of statin. Contact your healthcare team if there is no improvement or if this is severe. Constipation, which can be relieved with increasing fiber and fluid in your diet or asking your pharmacist for over-the-counter options. Gas, indigestion. Contact your doctor if this is bothersome and not getting better. Your doctor will be monitoring you for muscle pain and do regular blood work to check cholesterol level, liver function. It's important to remember that the statin's effect on the plaque is powerful, but it takes time, so you will have to check cholesterol levels routinely to see how much your statin is helping you. The anti-plaque effect goes away if you stop taking your statin, That's why statins are usually taken for life, even if your cholesterol levels return to normal limits. The last medication I will discuss in this presentation is the nitroglycerin spray. This is an oral spray that works quickly to stop an angina attack that has already started or may be used to prevent angina if you plan to exercise or expect a stressful event. This medication does this by widening your blood vessels of the heart, making it easier for blood to flow through and let more oxygen-rich blood reach your heart. Better blood flow means your heart doesn't have to work as hard and also relieves the pain associated with heart muscle not receiving enough oxygen. The University of Ottawa Heart Institute's Coronary Artery Disease Management Guide has steps for what to do when you experience chest pain. If you are having an angina or heart symptoms, at the first sign of angina or heart symptoms, stop immediately and rest. Sit down. If no relief immediately with rest, take first nitroglycerin spray. If no relief within 5 minutes, take second nitroglycerin spray. It's a red zone alert. If no relief within 5 minutes, call 911 and take third nitroglycerin spray. The red zone alert is unrelieved angina or heart symptoms such as chest, jaw, neck, or arm pain after taking the second nitroglycerin spray. Being very short of breath, sweating, nausea, or racing or irregular heartbeat, feeling weak, or feeling like you're going to pass out, you need to see the doctor right away. Call 911. It's important to know how to use the nitroglycerin spray properly. Let's review the steps outlined in this slide. Prime pump if needed, such as before the very first use. Some products may have different ways to prime the pump. Some pumps may also need to be primed if not used for different periods of time. Follow how and when to prime as you have been told. Priming sprays should be directed away from the patient and others. Sit down, as nitroglycerin can affect blood pressure and lead you to feeling lightheaded, dizzy, which can make you fall. It's important you are sitting. Then remove cap. Do not shake. Spray on or under the tongue. Push the spray canister button once. Close mouth immediately after spray. Avoid swallowing after use. Avoid rinsing the mouth for 5 to 10 minutes after the use. You can repeat sitting down to the last step here if still experiencing symptoms. If you have taken 2 doses and your chest pain is not going away, call 911. Then take the third spray. Some common side effects include mouth tingling, should go away on own, dizziness, possibly from lower blood pressure, important to get up slowly when pain is gone and no longer feeling dizzy, headache, can take acetaminophen or Tylenol if needed. Contact your doctor if side effects are not improving or severe. Please check how much fluid is left in the pump on a regular basis. Be sure you know when you need to get a refill. Check expiry of your nitroglycerin spray regularly. This medication may catch on fire, so do not use near an open flame or while smoking. Be sure to talk to your doctor to know what your dose is, how often you can take a dose, and when you may need to get medical help. If using this medication to prevent chest pain, use it 5 to 10 minutes before an activity that may lead to chest pain. It's important that you do not take more than it's been prescribed for you. Taking more of this medication or taking it more often than you have been told may cause it to not work as well. This is known as tolerance. Talk with your doctor if this medication is not working well for you. Now that we have discussed commonly prescribed medications, I want to go over how to store and dispose of your medications properly. When you pick up your medication from the pharmacist, you will be given instructions on where to store your medication. Medications that are to be stored in room temperature, such as all the medications discussed in this presentation, it is recommended that you do not store medications in warm or humid places, such as the bathroom or on top of the refrigerator. Rather, store at room temperature in a dry place. Choose a location that is away from heat or open flame. Keep all medications in safe containers and out of reach from children and pets. Take your old, expired, and unused medications back to the pharmacy. Do not put them in the garbage or down the sink or toilet. Now, I want to share with you some tips to help you take your medication. Fill all your prescriptions from the same pharmacy right away. When you use one pharmacy for all your medication needs, the pharmacist can check your profile for medication interactions to let you know if a new medication will work well with your existing medication regimen or if another medication may be a better fit. Report side effects that you feel to your doctor and pharmacist so it can be recorded in your file, and another approach can be tried to continue your treatment. Update your pharmacist of any medication changes made by your doctor. If you get a blister package from the pharmacy, they can update the blister package for you. Know how many refills are left and order a few days early. Take each medication at the same time each day at the dose that you have been prescribed. Forgetting to take your prescription medication once in a while happens to everyone, but there are things we can do to prevent missing doses of your medication. Try these simple tips, such as setting an alarm, using a calendar that you look at every day to record whether you took the medication for the day. Use pill organizer box that you can load up once a week with all your medications, or ask your pharmacy to prepare blister packs for you, which are weekly packages of your medications, so you'll be able to track whether the day's doses were taken. You can set a reminder on smartphones and watches. Pair it with a daily habit, such as if you take your medication in the morning, put it next to the cereal box. Or if it's a medication you take at night, you can put it on the nightstand, if it's safe to do so. Taking medication when you do other daily tasks will help you remember. In the event of a missed dose, take a missed dose as soon as you remember. But if it's close to the time for your next dose, skip the missed dose and take the next dose at the normal time. Do not take 2 doses at the same time or take extra medication to make up for the missed dose. Finally, some general medication management tips to keep in mind are: many heart medications, including some presented today, are also available as combination products. For example, perindopril with indapamide is a combination product of an ACE inhibitor and a diuretic. These were discussed individually in this presentation, and as a combination, it combines the effects of 2 types of medications in one pill. If your medication is not listed in this presentation, you may want more information, and you can ask your pharmacist for that. Always talk to your doctor or pharmacist before starting any new medications, including prescription, non-prescription such as vitamins or herbal remedies, supplements, and salt substitutes which contain potassium, to make sure it can be taken safely with your current medications. Do not change your dose or stop taking your medication without discussing with your healthcare team. Do not share your medications with others, and do not take anyone else's medication, even if their condition appears to be the same as yours. When you read the label on your prescription medication, you may have noticed that the generic medication you pick up from your pharmacy has a prefix such as an APO or TIVA or Sandoz, to name a few, in front of the generic name to indicate which generic company made that medication. Generic medications contain the same amount of the active ingredient as the brand name. Health Canada checks the quality and safety of all prescription products. Please note that the list of medications provided in this presentation did not include every generic or brand name available. If your medication isn't on these lists, ask your pharmacist for more information. I recommend you always keep an updated list of all your medications in your wallet and/or cell phone. Many pharmacies provide wallet cards. Bring this list to all your medical appointments. If you have any questions about your medications, ask your pharmacist. I want to make you aware of Ontario's MedCheck program, which provides free pharmacist consultations. This is an important appointment you can make with your pharmacist to go over your medications, why you are on them, and answer medication-related questions that you may have. Remember, medications are a part of the process of helping your body and work alongside lifestyle changes such as diet, exercise, smoking cessation, and reducing stress. This concludes the presentation on commonly prescribed cardiac medications. Thank you for taking the time to view this.